Good afternoon. Today I'll continue to be talking about the latest updates and news about the coronavirus. So the first thing I'd like to talk about is Germany. Germany has confirmed over 1,600 cases of the coronavirus in the country, which is an extremely high number compared to countries around the world. Yet it has only around 40 to 50 deaths in the country, giving it a mortality rate about less than 0.5%, according to data from Johns Hopkins University. This is really surprising compared to other countries such as the UK or the US, where an example is in the UK, there's only 2,500 cases, but about 138 people have already died. So the first I'd like to talk about is that Germany has a really expansive testing program. Approximately, the laboratories in Germany test about 100 tests per week, and this is well above the number of tests being carried out in other countries. Even South Korea, which is famous for its number of high testing cases, but Germany is undergoing almost basically testing everyone in the country at a pretty fast rate. What this leads to is that as the more tests are being produced, I guess, or carried out, people with mild or just starting symptoms can be found, such as maybe people who symptoms haven't even begun to start yet is already found to be tested positive. So basically these people are still counted as a number of the coronavirus infection, but because their symptoms are so mild and it's not deadly, then we don't have a high mortality rate because, well, these people haven't yet progressed to the severe symptoms which would lead to death. The second thing I'd like to talk about is that Germany's confirmed cases are basically 80% of all Germany's confirmed cases are people below the age of 60. What this means is that because people who are younger have a lower mortality, people who are younger than 60 usually don't die from this virus. It is often the people who have a compromised immune system, which is the elderly population, and people who have underlying diseases already in their bodies, which is also the elderly population. So this disease is fatal to the elderly, but not to the younger people. And since Germany has such a low number of the elderly population getting sick, only 20%, then this can be shown that Germany probably won't have a really high death rate. The third thing I'd like to talk about is that Germany is also trying to take expensive healthcare system, because I think currently they are not reaching problems that the US is facing, such as lack of equipment or anything, but Germany has already just brought 10,000 ventilators, which is necessary equipment to help keep the body breathing when the body's lungs aren't working. And they've already purchased so much vital equipment. So I think that their healthcare system is pretty well structured and able to handle a pandemic as severe as this is. However, despite all of these number of cases, I still think that it's important that because of all this, the pandemic is still in the early stages in Germany, and so I think as a result, as time progresses and these mild symptoms become severe or more people from the elderly population is getting sick, I think that the death rate is definitely going to climb in Germany, despite its really low mortality rate currently. But I think, and scientists have agreed that since Germany is still at such an early stage, the death rate is bound to be climbing, and much of the world it's still not the height of the pandemic yet. So just be prepared, wash your hands, and just be self-aware. Thank you for listening, and I hope